Good evening, everyone. Welcome to our telephone town hall meeting with the Texas Medical Association, TMA. Tonight's topic is reviewing the top issues for medicine in the state of Texas prior to the legislative session that will begin in January of 2019. And with that, it is my pleasure to hand our opening remarks over to Dr. Sheldon Gross, who is the president of the Bexar County Medical Society. Good evening, Dr. Gross. Thank you so much for joining us this evening.
Thank you, Jason. Good evening, everyone, and welcome to this Texas Medical Association telephone town hall meeting on legislative priorities for medicine as we approach the 2019 session of the Texas Legislature, which convenes in January. This is the second in a series of 5 area teletown halls that TMA is hosting. At this time, it is my pleasure to welcome TMA President Dr. Doug Curran to our Bexar County Medical Society offices and to this call. Dr. Curran is a family physician with UT Health East Texas and Lakeland Medical Associates in Athens, Texas. He graduated from the University of Arkansas for Medical Sciences and completed his residency at Southwestern Medical School Family Medicine Residency Program at John Peter Smith Hospital. Dr. Curran has spent 42 years advocating for the patients and physicians of Texas. Whether medical liability reform, patients' rights, improving CHIP and Medicaid, or scope of practice fights, he's seen it all, and he has done it all. The self-titled country doctor is proud to have cared for generations of the same families in his hometown. It is my great pleasure to introduce my friend and my colleague and the president of Texas Medical Association, Dr. Doug Curran.
Thank you, Dr. Gross. It's really great to be in San Antonio. It's just a great place to come. It's a great place to enjoy, and I'm excited we get to talk with my colleagues in this area. I'm looking forward to the conversations this evening. I encourage you to participate. I want to remind you that we're fortunate we have the largest medical society in the nation. We're 51,000, pushing toward 52,000 members. That's physicians, students, et cetera. And our specialty is a component of 112 medical society chapters. And we've had great success in modifying legislation and working on regulations and issues in the past, and we intend to have that as we approach the 19 legislative session. During 2019, we're going to be successful in lots of areas. I also want to remind you that Texas physicians are a huge economic driver for our state. There are 52,550 physicians practicing, seeing patients in Texas, and they create 670,000 jobs. That's 13.1 jobs per physician. We also generate $118 billion in economic driving. That compares to higher education, which generates $10.98 billion, and legal services $43.5 billion. So we're at least 3 times as big a driver as legal services. I'm glad to be here. I'm excited about the evening, and we're going to get back to you in a few minutes, but we're going to introduce some other folks first. Thanks, Dr. Gross.
Thank you, Dr. Curran. Dan Finch is TMA Director of Legislative Affairs, acting as traffic cop to keep things moving for tonight's TMA Teletown Hall on the 2019 legislative session. Dan?
Dr. Gross, thank you, and thanks to the Bexar County Medical Society and the 30 physicians who have gathered up here to try to be extraordinarily quiet, which is not a usual trait of physicians, so thank you very much. We're delighted that you've joined us tonight. There are a few, I want to go through a few ground rules and introduce you to a couple of different folks, and then we'll get back to Dr. Curran as quickly as we can. We'll generally try to do this in about 3 or 4 sections of subject areas. The first section that we'll cover is the budget, and we'll include Medicaid, maternal health, and graduate medical education, insurance issues, public health and prevention issues, and then finally sort of a catch-all topic of practice issues and that scope of practice, opioid legislation and the challenges that confront us there, and licensure issues with the medical board. Next, if you're on the phone and want to join via the internet, you can join at the following internet address, textmed.org/TTH2018. This will work on your computer, but it does not work on Apple or Android mobile devices. And so the answer to the question that will come at the end of the program is get involved, attend First Tuesdays, subscribe to TMA Legislative Hotline, answer action alerts, and talk to lawmakers, but you knew that. So let's move ahead and get started. I'm very pleased. 2018 is a political year. There are elections. We've still not yet completed them. The November elections are coming up in only 5 weeks. We're delighted to bring in Dr. Alex Kenton from San Antonio, who is Vice Chair of TexPAC, the Texas Medical Association Political Action Committee. And Dr. Kenton, I will throw it to you.
Thank you, Dan. So I just want to start out by saying that TexPAC is one of the key pillars for the House of Medicine. If any of you have heard my speech, really feel like the three pillars of the House of Medicine is the TMA, TexPAC, and the county medical societies. And without TexPAC, we can make all the policies and recommendations we want, but the reality is, and the sad truth is, without contributing and forming relationships with the politicians, with our legislative leaders, we can't get a seat at the table. And TexPAC is critical to allow TMA and your leadership and your lobbyists to get a seat at the table to advocate for the issues that are important, critical issues. For me personally, one of those would be Medicaid. You can imagine with a Republican-dominated legislature, it's hard to talk to a Republican about Medicaid. But because Medicaid is so important to us, because it's important for reimbursement to get subspecialists to see my patients, it's important that I get in front of those Republicans to talk to them. And without TexPAC support, they won't give us the time of day. This year, we've been heavily involved. We've been supporting our current friends in the Texas legislature, as well as making new friends, those in open seats, and, of course, those who have upset their original incumbents. To be clear, our success, TexPAC's success, is medicine success, and it's driven by local physician involvement, by candidate interviews, local physician involvement in campaign meetings. We have Physician 4 as well as our county medical societies. And we're stronger with your involvement and your membership. I want to remind you the last day to register is October 9th, and early voting is going to begin October 22nd. It's going to end November 2nd, and Election Day is November 6th. So please get out there and vote for our TMA TexPAC endorsed candidates. And while we don't know the final composition of the Texas House and Texas Senate until after November 6th, here's what we do know. There was recently a special election. Bexar County knows about this. And that special election, although was expected to be won by a Democrat, actually was won by the Republican candidate. If nothing changes, that gives the Republicans a solid two-thirds majority in the Senate with 21 of the 31 seats. Our expectation is there could be anywhere from 5 to 10 House seats that flip from Republican to Democrat, but still that means the Republicans will still have a very large majority going into the session. So we've got to make our contributions because we are the party in medicine. We're not a Republican Party. We're not a Democratic Party. We are bipartisan. And unfortunately, that means some of our issues don't go very well with some of the Republican issues that they're concerned about. So we need as many contributions to TexPAC as possible. Those get turned around to form the relationships with those legislators, and that allows TMA to have a significant seat at the table. So for those of you who are already involved, thank you, but we need many more of you. Thank you.
Dr. Kenton, thank you for joining us tonight, and we appreciate your message. I want to introduce one more speaker to you. Dr. Jason Turk, a pediatrician from Fort Worth who serves as the counsel on legislation. Dr. Turk, session starts in January for 140 days. What are some of the dynamics that we'll face, just very briefly?
You bet. Well, we're going to see more than 7,000 bills and resolutions introduced in the session, and about one-third of those are going to be dealing in some way, big or small, with the health care. Like it or not, the legislature's effect on our practices and our patients is huge, and if you're not at the table, then you are surely on the menu. I assure you that TMA will be present and heard from to defend what needs to be defended and to advance the cause of our patients and the physicians who care for them. While the Senate and its presiding officer, Lieutenant Governor Dan Patrick, look to return with a supermajority in 2019, the same cannot be said about the House of Representatives. One, the House must elect a new speaker, and while that has been the subject of great discussion around the state, it also means we're going to have new committee chairs, new committee members, and new committee staff to hire. So while we expect the Senate to quickly begin its work, it's going to be some time before the House infrastructure is in place, and that's going to act as a speed bump for at least the first month of session. But at the end of the day, the legislature has only one must-pass bill, and that's the budget. Typically, that process takes the entire session to iron out, and other bills are often held hostage by one chamber to pass its own version of the budget. Maybe this is the year that they'll only pass one bill, but I certainly wouldn't count on that. Last thing, I think it's important to thank the other 17 members representing both primary care and specialty care on the TMA Council on Legislation and the incredible lobby staff of the TMA. This really is a hard-working group, and they spend countless hours looking at and developing the best approaches to our issues. If you have questions about a particular issue, don't hesitate to reach out to any member of the Council on Legislation. Thank you.
Dr. Turk, thank you for joining us. We appreciate you being with us tonight. Now, Dr. Curran, welcome.
Thanks, Dan.
Always a pleasure to be with you. Let's talk a little bit about the budget. And when I say the budget, that means Medicaid, Medicaid managed care, maternal health issues, and graduate medical education. Healthcare is about a third of the Texas budget. I mean, with a total biennial budget of $210 billion, healthcare spending, and a lot of that is in the Medicaid program, is $75 to $80 billion of that total. Where's TMA's priorities in the coming session?
Well, there's no doubt. Medicaid's always a big issue because it's a big figure, and of that $216+ billion bill that we'll be dealing with, a big chunk of that is Medicaid. There's no doubt about that. But the reality is that our Medicaid population is continuing to expand, and that our state is growing at an astronomical rate. We see a minimum of 400,000 folks that are probably going to be present this year, probably closer to 500. Last year, we grew by 400,000. And so we're seeing an expansion of the Medicaid population. And physicians have not had a change in payment for 2 decades. And enough's enough. We're going to have to go after that. We need parity with Medicare for physician payment in Medicaid. And we're going to ask for that this year. We're going to point out that it just can't continue. Patients cannot get care. Access is inadequate. And then managed Medicaid has just been a real challenge. We have met with them on multiple occasions and have an upcoming meeting with them. We're going to continue to work with them. I'm sure a number of you saw some of the articles that came out of the Dallas Morning News that were very frustrating. The behaviors of managed Medicaid is just ridiculous. It is out of control. Networks are inadequate, difficult, challenging circumstances on multiple corners. Additional administrative burden just is enormous, and it continues to drop down. We have to push back on all these issues. And I think we're also going to have to begin to reach out to other participants to add physicians into the group, and that's not going to happen unless we can pay better. So payment's going to be a big issue.
One of the issues that has come up is, and not just in payment, it's the bureaucracy and the red tape of the program, the credentialing process that the managed care plans.
Yeah. Even in my own practice, we have just had a pediatrician join us. She is the only pediatrician in our county, and we've been trying to get her credentialed with Medicaid and managed Medicaid since March of this year rather, and it's taken 6 months to get credentialing done, and it's still not done. So she's seeing patients, and we'll try to back bill some of this, but they won't pay some of it. We got to put a stop to that, and we're going to work really hard to deal with these people during the legislative session when we can hold them accountable and responsible.
Yeah, within the issue of Medicaid, one of the things that's come up very clearly over the last year is the whole issue of maternal health. And initially,
Absolutely.
Texas maternal health numbers looked exceptionally bad. We went back, or I guess we went back, and we found out that the rate was not as high as originally estimated, but it still is not a good rate at all.
It's still dismal, Dan, and we can't have that continue to happen in our state. Our mothers deserve better, and we've got to do better with maternal health.
And with in excess of 50% of the births in the state being Medicaid. Mm-hmm. One of the problems with maternal health is that moms qualify for only 60 days postpartum care, and access to care is a huge issue. And TMA is going to be proposing what kinds of solutions?
Well, I think access to care is enormous, not just in Medicaid, but in the working poor, and all that fits into our goals. We must expand adequate care to everyone, and we've got to see a much improved time frame for women. It needs to be closer to a year rather than 6 months for them to get adequate care in the peripartum time frame. And in addition to that, GME's on the table, Dan. We're going to see that a bunch, and we're going to see graduate medical education moving forward, and trying to provide enough slots for residents is just a continuing challenge. We're expanding medical schools, but we got to also expand residencies, and that's a lift that the legislature is going to have to do.
Last session legislatively, we got in the statute a requirement for 1.1 new residency training slot for every graduating medical student, and this has taken years to accomplish to get above water. And now, of course, we're talking about the addition of 3 medical schools: Sam Houston State in Huntsville, University of Houston in Houston, and TCU in Fort Worth. Is there a commitment to add GME as we expand the number of schools?
Well, we're sure going to point that out, and we have to push to get that commitment. We made that stance, and we got that commitment from the legislature. You have to remind them what's going on, or it won't happen. And we're going to be reminding them of the 1 to 1.1 ratio that we have to keep telling them. And I encourage our members, as you visit with legislators, be sure and help them remember that has to happen, or we lose residents. It costs the state a lot of money for those residents to go somewhere else and train, because most of the time when they train there, 80% of the time they stay where they trained, or within 200 miles of that area. I'm living proof of that. I trained at Peter Smith in Fort Worth, and now I practice in Athens, which is about 120 miles away. And I went to medical school at the University of Arkansas. You heard that in the opening bio. So I'm here because of where I trained. So it's important that we make this happen.
We're happy to have stolen you however many years ago from the state of Arkansas.
Well, it's been great.
I should have. I'm reminded to for those of you who are on the phone and wish to ask a question, please push 0 on your phone and get in the queue. I want to ask you one more question about Medicaid, and we probably and then we should probably move on to insurance issues. Medicaid expansion. Texas didn't do it back in 2012 or 13, and we've talked about it. We've talked about repackaging. What are the prospects? What are the likelihoods? And what are the pitfalls moving forward for that?
Well, of course, it's a lift. Our House voted to expand Medicaid, and we, as an organization, tried multiple ways to get that done. We worked with Representative Zerwas on a bill that he pushed out. I testified multiple times in favor of that bill, and we got really close, but the politics were just not there, and we couldn't get that to happen, and so we could not move forward with Medicaid expansion. I think it's going to have a different approach. It's going to have a different name. I hope we can move away from the business of Obamacare. I think that is not a good term for the Affordable Care Act. We should call it the Affordable Care Act. And it is a law that was passed by the legislators, and hopefully if we can work within that framework, we can move forward some alternate plans. And I think we are talking with some people about bringing some of that money through different channels, and we'll continue to work with that. But it has to be the right thing, and the right people have to carry it. And I think we got to get it moving forward. But our stance will be to draw down every federal dollar we can to take care of our people, and that includes the Medicaid expansion dollars, if we can get them in a framework that the Texas legislature feels like it can live with. But we need that money to help take care of our working poor.
We're going to stop and introduce a polling question for you right now. Jason, are you there?
I am. We'd like for you to answer this polling question. Everybody who's currently listening to this call, if you can please respond to this polling question by using the numbers on your telephone keypad. We'd like to ask you, which do you believe Texas must prioritize to build the physician workforce? Please press 1 on your telephone keypad for more medical school capacity. Press 2 for more GME capacity. Press 3 if you believe the answer is both of those previous options. Press 4 if you believe it is neither of the first two options. And press 5 on your telephone keypad if you're unsure. Again, we'd like those of you in our listening audience to give us your feedback on what you believe Texas must prioritize to build a physician workforce. We'd like everyone who's listening to respond to this, and you can do so by pressing the numbers on your telephone. Press 1 for more medical school capacity. Press 2 for more GME capacity. Press 3 if you believe that Texas must prioritize both of those. Press 4 if you believe Texas should not prioritize either of those first two options. And press 5 if you are unsure. Starting to see some responses come in. We would love to hear from everybody who's listening on this call, and we can go over some of the results here in a moment. We're going to leave this poll open. Just one more time, what do you believe Texas must prioritize to build a physician workforce? Press 1 for more medical school capacity. Press 2 for more GME capacity. Press 3 for both of those options. Press 4 for neither of those previous two options. And press 5 if you're unsure what Texas must do to build a physician workforce. We appreciate everyone who's listening to the call and taking the time out of their evening to join us and answer our polling questions. Remember, if you have a question for tonight's event, we are going to be having live Q&A come up. Please press 0 on your telephone keypad to submit a question. Again, 0 on your telephone keypad to submit a question. We already have a couple rolling in for our Q&A period. And back to you, Dan.
Great. Thank you, Jason. Right now, as far as we can tell, it's almost evenly split between both more GME capacity and medical school and more GME capacity, but we'll keep it open for a little bit. Let's move along to insurance issues and commercial insurance. And this is always Dr. Kern, this is always a biennial challenge for us. And in the last number of sessions, every session we've seen legislation that would impact physicians' ability to balance bill in situations where they're out of network. We're seeing more physicians being out of network because of issues related to the adequacy of commercial insurance networks. Where will TMA be focusing its efforts?
Well, we're going to continue to push on insurance companies in regard to payment. I was just talking with an orthopedic group today here in town, and they were telling me that they're trying to push their payment. You know, insurance companies, United, Blue Cross Blue Shield, all of them are trying to push their payments as close to Medicaid. That's Medicaid rates as they can get. And we all know we can't survive on Medicaid rates. There's no way that can happen. So we have to push back on payment. Networks are terrible. They keep tightening up the networks, inadequate coverage, and as a result, patients have to go outside of network to just get care. I mean, common sense, easy care. They can't get it. So we have to point out the inadequacy of the networks that are there. And then they add the prior authorization and all of the administrative hassles on top of that to keep us from being able to take care of our patients. We've got to point that out. The doctors I talk to as I travel around tell me that the administrative burdens of their practice is just overwhelming them. We've got to put a stop to some of that, and we're going to work really hard on that during the next legislative session. But we really have to improve payment so physicians can survive. Yes. And I think with the things that are coming down from Medicare, I wonder with the changes that there, if the insurance companies aren't going to try to mark the mark to Medicare, and if they do, that's going to change how we're paid as well. So I think we have to really watch all those things. And then, of course, the ER policies that are out there are very disturbing as limiting your ability to go to the emergency room may not pay. That's ridiculous. We can't have that, and we'll push back against those things. And then telemedicine bill we passed during the last session. It's hard to get paid for that. I know our group has tried to get paid from insurance companies, and we haven't been able to do that. So those of you out there who are doing some telemedicine or requesting payment, let me know how it's going. I need to know that. We at TMA need to know that so we can push back and get them to do the right thing in the insurance arena. They need to tend to us in telemedicine and these other issues.
And of course, and you've made the point in the past too, that the use of telemedicine and even expanded office hours, if companies are going to retrospectively deny for emergency care, then we have to provide people patients the avenue of seeking care in an after hours or via telemedicine. And you know as well as any that we were careful in drawing the telemedicine bill last year to make sure that it adhered with the accepted standard of care for in-person care, same standard of care, and while the language we thought was clear that views telemedicine as a means of providing the service, not the service itself, it seems to me we may need legislation that says a covered service provided to an enrolled individual by a contracted physician must be paid for.
Exactly, Dan. We're going to have to be a lot clearer about what we want. And I think some of the details going to have to be there. And I think that's just sad. It's a tragedy that what ought to really be happening is we're working with these companies to provide good, high-quality care for the patient in the most cost-effective manner. And we're just not doing that. We're getting pushed back from every corner to not pay us for what we do. We work really hard, and I tell patients I tell my friends all the time, I actually make about what a plumber makes. I just work 2 or 3 times as many hours as a plumber does. So I assure you that we're earning what we get. And I'm telling you, in all the areas of payment, insurance companies just fight us on every corner. So, and we're going to take them on in this next legislative session.
So even family doctors do a little urology.
Absolutely, we do urology as well. Only when we have to, of course. We have our urology colleagues that we get them to help us out quickly most of the time.
Again, if you'd like to ask a question, please press 0 on your phone. Can we return to the issue of GME and Dr. Bagg's call?
Dr. Bagg,
yes,
you're on live.
I'm Dr. Bagg at the Hand Center San Antonio. Thank you for taking my question. We are in a small 6-man group. We call it Privatedemics. We're private practice, but we're an academic private practice. We have 4 hand fellows per year, and I'm really glad to see that your emphasis to try to improve access to GME. I also wanted to ask if there was any priority for looking not only for GME for residency education, but also for fellowship, because we basically pay for this ourselves. We get hand fellows from basically all over the country, and it's really done on our back. We don't get any reimbursement for it. And so I'm just looking to see if in your legislators' priority, would you also be looking to, look at fellowship opportunities as well as residency opportunities?
Well, absolutely.
Thank you so much.
Yeah, absolutely. I think we'd be looking at trying to help all residents as they move forward, fellows or otherwise. I think we want to do our best to empower physicians to get appropriate training. And graduate medical education is where that's going to come from.
Right. Back to the insurance side, and Jason, I would like to ask you to do another poll question, this time on telemedicine.
Absolutely. We'd like to ask you in the listening audience if you currently or will use telemedicine in your practice to care for patients. Please press 1 on your telephone keypad if you do. Press 2 on your telephone keypad if you do not. Press 3 if you plan on using telemedicine in your practice in the future. Press 4 if you do not have any plans to do so. And press 5 if you're unsure if you're going to incorporate this into your practice at this time. Again, we'd like you in the listening audience to answer our poll question by pressing numbers on your telephone keypad. Please press 1 on your telephone keypad if you currently use telemedicine in your practice to care for patients. Press 2 on your telephone keypad if you do not use telemedicine to care for patients. Press 3 if you plan to. Press 4 if you do not plan to. And press 5 if you're unsure. Just really quickly, if you answered in the previous 10 seconds while I was talking, it doesn't look like our poll was calculating. So if you could please answer the question again one last time. Do you currently use telemedicine in your practice? Press 1 if you do. Press 2 if you do not. Press 3 if you plan on using this in the future. Press 4 if you do not plan on using it in the future. And press 5 if you're unsure about the direction you'll go on this particular issue. Again, if you had answered at the beginning when I started talking, it didn't look like our poll was loading. So please go ahead and just simply hit your answer now. We'll leave that open here for a moment or two while we collect your responses. Again, we thank everybody for answering our poll questions and joining us this evening. And I would like to hand it back to you, Dan.
Great. Thank you, Jason. I can tell you from watching the numbers come in that it seems that maybe 15% are currently providing telemedicine, and an equal amount, 14 or 15%, are actually looking to be active in telemedicine in the future. And while we're collecting more numbers on this, let's move on to public health issues, because the motto of the Texas Medical Association is physicians caring for Texans. And a good bit of that revolves around public health policies, which become very difficult in the legislature with the makeup that we have it. And yet, our devotion to good public health, both in terms of prevention, remains consistent from session to session. Talk about vaccine issues, because it's become not only a scientific issue, but a political issue in the Texas legislature.
Well, Dan, you know as well as I do that public health issues are the thing that's made the biggest difference in our country. Vaccinations and vaccines have just been enormous in helping our people stay healthy. And we want to be sure that everybody gets vaccinated. And we always have a significant group of people that are very vocal. They're truly a minority, but they're very vocal against vaccines, and we have to deal with those every session. But we know from a study that we just recently did that there is the vast majority of Republican voters, overwhelmingly support vaccines. And we want to be sure that legislators understand that. We have primarily a Republican-dominated legislature, and they need to know that they don't need to be frightened by people who oppose vaccines. The vast majority of their political backing is going to be supportive of vaccines. So we want to be sure that we're promoting them and that we're not backing up from vaccine administration. In addition to that, Dan, we've had a lot of problems with advanced directives over the past 2 years and struggling with those, and we're going to have to readdress that issue during this next session. They've become complicated and confusing, and we've got to get some clarity back into advanced directives so we can really take good care of our people. Spending a lot of money in the last few days of life that's unnecessary, and this futile care has to be managed properly, and we got to do a better job with that. So we've got to deal with advanced directive issues, and we're going to see a number of other issues. Tobacco 21 always is there, and we got to move forward with getting our folks to get the tobacco habit out of their lives, and it will make an enormous difference. And with vaping and all the other issues that are out there, those have to be addressed as well.
And I think it's only appropriate to recognize that here we are in Bexar County and San Antonio, Texas, and the only city in the state that has actually implemented a Tobacco 21 ordinance to ban the sale of tobacco and vaping products unless you're 21 years old. Yes. And that's an enormous achievement, and congrats to the medical society and the community.
Way to go, San Antonio. Good job. Good job.
Again, if you have a question that you would like to ask on almost any issue at this point, please hit 0 and we'll stick you in the queue. Any other issues related to public health that we need to?
Well, Dan, we know that the state lab has had some issues in just getting information back to us, and we know that there's been a significant increase in the number of sexually transmitted disease, and getting information about that back has sometimes been slow. Information on Zika and some of the other things. So we need an empowered state lab, which we have not seen yet. So we want to really work on some of those issues as well.
Before we end the discussion on public health issues, Jason, I'll ask you to run the third polling question on vaccines.
Absolutely. We would like to ask you in the listening audience, if you counsel your patients to get the required and suggested vaccinations, please press 1 on your telephone keypad for yes, you do indeed counsel your patients to get required and suggested vaccinations. Press 2 if you do not, and press 3 if this isn't necessarily applicable to your practice. One more time, we're asking you in the listening audience, if you counsel your patients to get required and suggested vaccinations. Press 1 on your telephone keypad if you do indeed suggest that they get vaccinations. Press 2 if you do not, and press 3 if this is not applicable to your practice. Thank you, everyone, so much for answering our polling question and being on our call tonight. Back to you, Dan.
Very good. Thank you. Overwhelmingly, 72 to 73% of you, at least initially, are saying that you do, in fact, counsel your patients on appropriate vaccine levels.
And Dan, that's almost as good as Republican voters. They're at 86%. So that's
the
pretty good.
Are behind Republican
Their doctors
voters.
are behind the immunizations as well, and so are Republican voters. And that has nothing to do with supporting Republicans or Democrats, by the way. I personally split my ticket up pretty good, and I'm for anybody that's for medicine.
I understand. Thank you. Thank you. Let's move on to practice issues, and there are a variety of different areas and topics. And corporate practice. Dr. Curran, when you started practice law these many years ago, the idea of being employed and not running your own practice, your own business was fairly unusual, and yet today. It is a significant way of compensating physicians for their professional services.
Right. Well, I think we're seeing a continued expansion of corporate practice of medicine, and part of that's happening because of the inadequate payment. Physicians can't make ends meet, and so they have to do something different to continue to take good care of their patients, and they end up with I think sometimes having to go a different direction than they'd really like to go. But I also think there are physicians who want to be in an integrated network, and if they do that, that's really good. We want that to happen. But I also want those physicians to be able to practice independently, to take care of their patients appropriately, to use appropriate information, and not be forced to do extra testing or anything to increase income in certain environments. And I have talked with emergency room physicians who are being required to order extra tests just because a white gentleman with chest pain shows up in the emergency room who happens to be over 40. And his chest pain may be totally atypical, but the complete workup needs to be done. And we can't have things like that happening. If you see a bunch of back pain and you're working in a corporate environment, they may be coming around and saying you didn't order any MRIs on any of those back pains. What's going on here? We can't have that. We have to do whatever we need to do to make sure that physicians practice independently, are not told how to do things, and not told to do things that don't need to be done. And I think a lot of times we get the blame for that.
Or to do things in a certain way.
Absolutely. It needs to be the doctor's way in conjunction with the patient, not the corporate way.
You know, in 2011, we passed legislation that was specifically aimed at nonprofit healthcare corporations run by organized by hospitals to prohibit the interference in physicians' independent medical judgment. And there are a host of business reasons for physicians to join practices like this, and yet what is essential for physicians, for the TMA, and for all doctors, one is the patient-physician relationship and the sacredness of that, but also the protection of your independent medical judgment. There was legislation in the last session. The Texas Medical Board must certify an organization meets the qualifications to be a nonprofit healthcare corporation. And so we supported legislation that would create a complaint process within the medical board to handle that.
Yeah, it was Senate Bill 833.
It was.
And, just having a process where a physician who feels like they're being pressured to do certain things can push back is really important. And because at the end of the day, we really do want to take care of the patient, and we want to do what's best for the patient and most cost efficient for the patient, because that allows us to have resources that we can use the way we ought to be using them and not just to pad a major corporation's pocket. We got to be sure that we're using our resources that we have properly.
Absolutely. And of course, also with regard to the medical board, of course, they're back, their sunset bill, our sunset bill, your sunset bill, your licensing agency is back on the table again. It's Groundhog's Day all over again for 2019. What are some of the things that we're going to see in that sunset bill, and what's the likelihood of this being either held hostage or being passed?
Well, I think there's a lot of concern that they held it hostage last time and they got a special session out of it. And I think that's how important the Medical Practice Act is. But you always are anxious when you're looking at a Medical Practice Act that could be opened up, changed, modified, and we've got through the sunset process. We're moving toward getting that bill pushed out early. I had a conversation with the Lieutenant Governor within the past 6 weeks, and he assured us that was going to be on the agenda early. And my personal senator is the vice chair of this sunset committee, and we have talked to him about helping us move that forward. He's been real positive as well. So I think that's an example of where those relationships that TexPAC was talking about can really help us to move a bill forward.
Without a doubt.
We want to get that done early if we can, because that early success hopefully can lead to other successes as the session progresses along.
And of course, we will continue to pursue provisions to the medical board for the disciplinary process for physicians that include more transparency for physicians, more transparency of the process, and more fairness protections for due process for physicians who get wrapped up in disciplinary actions. I also would raise one more issue, and of course, one of the main functions of the medical board is licensure and relicensure of physicians. And we've seen an enormous growth in the board's licensing of the numbers of doctors. In the midst of Texas's explosive population growth over the last 10 years, we've also seen a growth in the number of licensed physicians. I think in 2002, prior to liability reforms, the board was licensing on average about 2,200 new doctors a year, and last year we licensed well over 5,000. And so there is a need for more doctors in Texas, and one of the issues that we've talked with the medical board in this interim, which I believe that they're very supportive of, is an expedited licensing process for out-of-state physicians who are well qualified, not touched by state disciplinary action, to really shorten the time process for getting a completed application process done.
That's a huge need, and it needs to happen, because even though we've had a lot of physicians come in, our state's still growing at an unbelievable rate. We're still ranked 47th as far as number of citizens to primary care physicians. So we're still way understaffed, and especially in rural communities. I mean, we are struggling in rural Texas to be sure that we provide adequate care and access to care. So the medical board needs to step up and make sure that happens. I had the privilege of meeting with the medical board with Rocky Wilcox, our lead attorney at TMA, and we met over some issues of fairness and issues that we think are making real progress. They've asked us to help them with things, and that's a good sign when we're working together.
And moving on to other licensure issues, there's an awful lot of folks that want to do what you do without having done what you've done. And what you have done is go to medical school.
Could you repeat that for me, Dan?
A perennial issue. Again, it's Groundhog's Day for us all. Is the issues related to nurse practitioners who want to prescribe independently.
Dan, I'm convinced that when my great-great-great-great-grandchildren are beginning to practice medicine, that there'll still be scope issues, and everybody's going to want to do what doctors do. And the bottom line is they just can't do what doctors do. And if we allow that to happen, then we've done a disservice to our patients. And the main issue that we have to continue to deal with is patient safety here. And we want to be sure that whoever practices, whoever touches our patients, whoever does things to them is well qualified, and they're well capable of doing that. Now, let me tell you, I have nurse practitioners and physician's assistants who work with me. They are fantastic, used in the proper way. And sometimes we're our own worst enemy. We want to be sure that they're properly supervised and that we work hard to make sure that they do a good job and that we empower them to take good care of our patients. So that team approach is what we've got to continue. We're not interested in allowing independent practice. It'll be asked for, but we're prepared to deal with that.
You know, in 2013, we went into session and worked with the nurse practitioners and PAs for an agreement. And we went in with the core principle that independent diagnosis and prescribing is the practice of medicine. Physicians can delegate but must supervise because ultimately you're accountable. Practice of family practice, for example, is considerably different than it used to be. As you recall, a solo family doctor with a registered nurse taking care of a panel of 1,800 patients now gives way to a physician, several APRNs, a PA or two, many nurse practitioners or registered nurses, and an entire billing office rather than a part-time. Medicine is very much a team sport anymore, and you're still the captain of the team.
That's exactly right, and that's what we want to continue. I think physicians have to be in charge so that patients are well cared for, and that's the bottom line, and I think that has to be our message. Don't want to complicate things too much. I think we just want to make clear that physician-led practice of medicine is exactly what we want, and we need a team. It's going to take a team to get the job done, and we're willing to work with people, but the physicians are going to be the folks that are leading that team. They have to be.
Let's move on to an area that has gripped the legislature over the last couple of years and will continue to do so in 2019, and that's opioids and the prescribing of controlled substances. And last session, legislation started out to require physicians to check the prescription drug monitoring program, which is an electronic database now run by the Board of Pharmacy, previously by the Department of Public Safety. The original proposals were all controlled substances, effective September of 2017. And as we went through the session, that was moderated to 4 groups: opioids, benzodiazepines, barbiturates, and carosperidol. Soma, I can never pronounce it. And the effective date is 2019, September 1. We have a session to work on that. Where are we? We have, in fact, had a hearing today. There is a move, and we last year talked about electronic solutions for the program, and we are emerging into an era where there is an electronic solution on the horizon for the near term, but not necessarily immediately, and that is the integration of this monitoring program with physician EMR systems. Talk a little bit about that if you can.
Sure. I think that's where we're going. In the meeting we had with the Lieutenant Governor, he absolutely indicated that that's where they want to go. And I talked with him in detail about the time I thought it would take me to look up everything for all my patients that I have. It's just not doable. It is not a functional way to care for patients. And we also, I think we have to be real careful. One of the greatest privileges we have as physicians is to relieve pain. And we should do that. But we should do it in the framework where patients are protected and properly cared for, and the opioids that we use are used wisely. And I want us to do that really well. But I also want us to really work hard to have the flexibility to take good care of our patients, and that includes relieving pain. That is our responsibility, and it's a great privilege. No one else I know of has that privilege. That's a physician privilege, and we should cherish that. We should work hard to make it right, and we're going to do that. We can't continue with that September date. That's just not going to work. We're going to do everything we can to move that, if we have to move it, unless we can get an electronic solution to that ahead of time. And we can't look up everything. We got to limit that. The wisdom of the House and our previous meetings have suggested limiting that. We'll work very hard to make all that happen.
Limiting specifically.
Limiting to Schedule 2s, yes. And we're going to work really hard to make all those things happen. But the best fix, I still think, is if we could get real-time data into my chart that I can look at and see, and I don't have to look up anything, it just appears in my electronic record, or it appears in your email. Because there's still some hard-nosed folk out there trying to do paper charts, and we just can't leave them at lurch. We need to be sure that they get some information. So electronic record, email is an option for us.
A question from one of the doctors here at the Bexar County Medical Society: with the upcoming mandated use of the PNP for certain medications, what is TMA's approach to ensure the interoperability of EMRs and the PNP? And perhaps the best question here, who bears the potential cost for this upgrade? And I do want to say that right now you can, in a custom arrangement with the vendor for the program, Appers Health, and for a fairly expensive cost, connect electronically with this. The Board of Pharmacy has a budget request in for a sum of money that would upgrade this service for all prescribers, physicians, dentists, podiatrists, whoever prescribes, and pharmacists. And because the vendor for Texas is the same vendor in 44 other states, some of this patchwork has already been done. And so the cost and that is absolutely a goal of ours, is to not impose this cost on physicians. But the cost for this is a relatively small amount of money, $5 million over the biennium. And the only additional cost might be from the individual EMR systems. But we already know that many of the EMR systems are compatible with this and could be enacted relatively easily.
Well, I know we're talking with our legislators and educating them about these issues in regard to cost for physicians and cost of expanding and appropriately modifying the system. I tell them the story that's happened to us. We just did our MIPS in our 17 physician practice, and it cost us $10,000 to upgrade our computer system so we could harvest the data for MIPS, and we got paid $6,600. You know, that's just not going to cash flow, Dan, and that's the world I keep living in. So I'm going to keep pushing back at them to do the right thing for us. We cannot continue to be upside down financially. I'm just a small business guy out there trying to survive. So we've got to get that fixed, and that's going to be something we work on really hard.
I got a hearing today, the story that was told by physicians and other prescribers and pharmacists is very much the same. Yes, ultimately, the electronic integration is a solution, but it cannot be accomplished by September of 2019, and there has to be some flexibility moving forward on that, plus for changes. And we've got some session to work on that.
Absolutely.
I do want to go back to a scope issue and go to Dr. Whitney on the line, who has a question. Dr. Whitney in New Braunfels, who has a question on nurse practitioners.
Oh, Dr. Morgan, Whitney Morgan.
Oh, yes, I'm
sorry. I was caught off guard.
Thanks for calling.
I thought y'all already addressed my question. So you discussed the scope of nurse practitioners and how that's a perennial issue, and I recognize that is the case. I saw the last session that in person showed up to just sort of see what the testimony process was like, and there were just at least 10 to 1 nursing students, nurses, nurse practitioners testifying for scope of practice expansion, which, most of us have been used to nurse practitioners in a role of collaboration for years. And these are nurses that have had extensive experience within whatever specialty they are practicing. What we're seeing over the last few years is this explosion of online nurse practitioner schools where they have, some of them, 100% acceptance rates. So we have, meeting people in person nurses who say, I'm an NP school. And I say, great, you must have so much expertise in burn care. And they say, I'm going to practice psychiatry, because there is just so little oversight once they get accredited in states that allow for private or non-collaborative independent practice. So I recognize that Texas will be dragged kicking and screaming, if at all, into this, situation. But I do think it's better that we not remain just on the defensive, because if 23 states have allowed this is a persuasive argument. And I say this as a pediatrician who will be soon opening, finally, after 13 years of practice, my own primary care practice in a rural area as a solo practitioner. And I want to employ a nurse practitioner collaboratively. Yes. But I think we cannot ignore this. I think we need to go on the defensive, the offensive, and make sure that we rein in the scope of practice issue.
Sure. We agree with you 100%. We want you to be able to collaboratively practice with them. Let me tell you, I've testified before on some of these issues as well. Tell you a good story. The last time I testified, the nurse practitioners were handing out apples. An apple a day keeps the doctor away. So anyway, it was a great experience. So it didn't keep us away. It didn't work. So we're going to continue to work on that. We appreciate your call. Thank you.
Thank you so much. And if you'll look in the October issue of Texas Medicine, there's a pretty good article about the lack of standards, or at least the need to impose some standards on the clinical side of nurse practitioner education. I'm going to say that we are at 59 minutes and counting, Dr. Kern, so thank you for the hour. Oh, yeah. All of you who have remained on the line have certainly qualified for your continuing medical education. I will ask you, before I ask Jason to read you the question for your CME credit, I will say thank you so much for joining us again, and for the 30 doctors who have joined us here in San Antonio at the Bexar County Medical Society building. Thank you for coming out. We appreciate you being here. Remember, if you still have a question or a comment that wasn't addressed, you can leave a voicemail at the end of the program, or you can email us at the Knowledge Center at the TMA, and that address is knowledge, KNOWLEDGE, at texmed, TEXMED.org. And thank you again to the Bexar County, Dr. Sheldon Gross, President of the Bexar County Medical Society. Thank you for having us. It's been a pleasure to be here, and a pleasure to have known you for as long as I have. And that wraps it up. Jason, you can read the CME question.
Thanks, everybody.
Our folks. Thank you again.
We are wanting to ask of those of you in the listening audience if you were going to implement any new strategies based on what you learned in this call, and if so, which ones? Press 1 on your telephone keypad for attending TMA's first Tuesdays at the Capitol Lobby Days this session. Press 2 on your telephone keypad for signing up for TMA Legislative News Hotline email reports. Press 3 for responding to TMA Legislative Action Alerts. Press 4 for either writing, calling, or speaking to legislators. And press 5 for more than one of the strategies mentioned. One last time, you're going to implement any new strategies based on what you've heard in this call. And if so, which ones? Press 1 for attending TMA's first Tuesdays at the Capitol. Press 2 for signing up for TMA Legislative News Alerts. Press 3 for responding to TMA Legislative Action Alerts. Press 4 for writing, calling, or speaking to legislators. And press 5 for more than one of the strategies mentioned. And it looks like our results are coming in. I just want to remind everyone, when this call comes to a close here in a moment, you're going to have the option to leave a voicemail. Please do so with your first and last name, as well as a telephone number or email address where we can reach out to you. All of the voicemails will be forwarded on to the Texas Medical Association. You've been listening to a live telephone town hall meeting with the Texas Medical Association. Thank you so much for joining our event this evening. Good night.